Good day, fellow learners. This is your mentor, your fact check buddy, joining you from the second floor of the Ray Gapuz building here at the United Nations Avenue in Manila, Philippines. So, this is our quick fix session number 27. This is for the next generation NCLEX RN pointers. Okay. So, this is set number 27 of our NGN pointers. And of course, we'd like to share with you this sharing that I'm about to explain in simple terms is a product of the efforts of our team. So I'm the only one who is tasked to share it to everyone, but this is a product of our team at the Ray A. Gapuz Test Preparations or Review System. Remember, the company name is Ray A. Gapuz Review System. So before we get to start, I'd like to ask you a question. What are the things that you need to study? If you don't know the things that you need to study, then you are not yet prepared to take the test. So it's best for you to get an expert's opinion. Now, the expert should be someone who can tell you how to study. It's very important that you need to have that sense of direction when you're preparing for the next generation NCLEX. Okay? So our first NCLEX RN alert would be for your RSV or your respiratory syncytial virus. Okay, now what is it? So it's actually an infection of the airway and the lungs. It's common among children. And what are the things that you need to remember? First, it requires contact precautions because the droplet spreads through coughing or sneezing, which simply means your healthcare providers providing care to a client with RSV should wear your personal protective equipment. And when we say PPEs, what are the things that we need to highlight? First, they should wear your fluid resistant or type 11R surgical mask. What does that mean? Well, your fluid resistant mask is repellent to it has a layer that is repellent to droplets. So in essence, it's best also to wear your fluid resistant surgical mask together with a face shield. So that's to ensure that your droplets don't get into the mucous membranes of the eyes or even the nose. Okay. Now, the second thing that you have to wear as a healthcare provider should be your single-use gown and your single-use gloves. So once again, don't forget your RSV requires your contact precautions. Okay. So what usually develops in RSV, there will be inflammation of the bronchial wall, and because of this inflammation, there will be excessive mucus secretion that may potentially obstruct the airway of the child. So this leads now to the croupy or seal-like bark cough, or they call it barking cough, that's due to partial obstruction of the airways. And this comes with low-grade fever. Now, these two main manifestations, the croupy or the seal bark cough plus low-grade fever, think about RSV and think about the PPE. You have your fluid-resistant surgical mask, and then you have your single-use gown, and of course, your single-use gloves. Okay, so let's move on. For RSV, just remember your dream car. Okay, this is my toy car. Okay, remember your BMW Z4 convertible. Why? Remember, the manifestations pertain to BMW, bluish skin color because of decreased oxygenation, B, breathing that is rapid, short, and difficult, okay? So it's not actually deep. So you have short breaths that are that's requiring the patient to have more efforts at taking in the air because of the obstruction brought about by the accumulation of mucus in the airways. And of course, M, mild cold-like symptoms like stuffy nose, and W, wheezing and nasal flaring. Now, pay particular attention to the fact that if initially there are wheezes and then eventually the wheezing disappears, it could simply mean that the airway obstruction has worsened. So wheezing is due to partial airway obstruction. When the airways are completely obstructed, so the wheeze disappears. So which simply means that the absence of wheezing does not necessarily indicate a sign of improvement. In fact, it could be a sign of a worsening condition and should therefore be reported to the healthcare provider. Okay? So for RSV, just remember your dream car. Once again, your BMW Z4. That's me driving my favorite toy car. Okay, and antibiotics do not treat your RSV because it's caused by a virus. So the good thing is when you have a mild infection, it could even go away even without treatment. However, if the condition requires treatment, this requires three things. Remember the code RSV requires administration of oxygen and moist or humidified air, and then administration of your antiviral agent, ribavirin, through aerosol. Then S, Synergis or your palivizumab. It's approved for the prevention of RSV disease in children who are younger than 2 years old or who are at risk for serious RSV disease. And of course, V, venous infusion of fluids or your IV fluids plus your ventilatory support. Remember, RSV. Okay, and BMW. Now, once again, I'd like to remind everyone that if you don't see us in your class, then you are not attending a Ray Gapuz system class, because a Ray Gapuz system class should have these mentors. Mentor Che, who is licensed in New York. Mentor Francis, who is also licensed in New York. Mentor Missy, who is also US licensed in New York. Mentor Shans, US licensed in New York and Vermont. Mentor Marisol, who is US licensed in New York and California. Mentor McLean, who is US licensed in New York. And of course, Mentor Nicole, who is an NCLEX passer and licensed in Ontario, Canada. And yours truly, that's me. Okay? At the rightmost portion of this picture ad, of course, your mentor, your fact check, but Ray Gapuz, I'm US licensed in the states of Illinois and Georgia. So once again, if you don't see us in your class, that is not a Ray Gapuz system class. So if you want the best NGN class in the whole wide world, join us. And you're in for a life-changing experience. So first, let's get inspired. This is from Jane Resurrection. Hello, Dr. Ray. Magandang buhay. That's saying happy life. I took my test last April 12, 2 days after my 60th birthday. Yes, senior citizen and proud to be a USRN. Look, she's a senior citizen. She's age 60. Okay, my secret to success is lots of prayers. This is the truth. I spent more time praying than studying, and it is because of my age handicap. I really notice I'm having memory problems at this tender age. I am thankful that I had a good nursing education foundation from the Philippines years, and it helps me to this day. It was hard to retain new information. My computer stopped at 104 after 3.5 hours. I was stunned. I remember pacing myself very slowly. When the computer did not stop at 85, I wanted to reach 150 questions. I couldn't even remember the last question. I remember praying in my head and said to myself, I need a miracle. God, please help me. So I went to Mass daily. I prayed hard before sleeping and when I wake up. And that was my cycle for the past 11 days of waiting. My anxiety was rising by the day. On the 12th day, God surprised me with this miracle. So I passed. Thank you, Jesus. All glory to you. So if a 60-year-old can, so you can too. So the most important thing is get into a program that will help you pass the test. Okay? So this is what Jane has to tell us. Now I am a USRN at 60. Life begins in it for me. I will use my remaining life in the service of safe healthcare delivery. To you, Dr. Ray, I give you my heartfelt thanks and I salute you for your lifelong commitment to improve the lives of not only Filipino nurses, but nurses from all around the world who believe in the Gapuz system. I see how you tirelessly keep going in producing Gapuz and NCLEX passers, critical thinkers ready to embark on the new generation of patient care. Big hugs and see you soon. Okay, Jane J. Serrano, USRN. Of course, she came and inspired our class. She paid us a visit, brought some donuts, and that's one of the important recipe to eat and partake from the treats of those who pass. So you're gonna swallow their lucky energy for your NCLEX exam. Okay, so our next NCLEX RN alert is actually on the concept of lumbar puncture. Now, what are the things that we need to remember related to lumbar puncture? The site is definitely between lumbar 3 and lumbar 4 because the spinal nerves would usually end at lumbar 2. So the doctor cannot insert the needle between lumbar 2 and lumbar 3 because that could potentially hit your spinal nerve. So the safe site would be between lumbar 3 and lumbar 4. Now, your lumbar puncture is usually done in order to check the CSF characteristics. Now, remember that your cerebrospinal fluid or CSF is approximately 100 to 200 ml and it is high in glucose and it's usually clear. However, okay, cloudy samples could mean that the patient could be having infection of the meninges, so meningitis or inflammation and infection of the brain or encephalitis, or when there's reddish liquid that has mixed with the CSF, that this could mean that there's hemorrhage. And of course, your CSF analysis could also help diagnose autoimmune conditions like Guillain-Barré syndrome and multiple sclerosis. Now, the primary concern of clients who are supposed to undergo lumbar puncture is what will they feel? So you just have to tell your client that you might feel as if someone is pushing your back. So don't use the word pain because anticipation of pain may increase the discomfort or pain experience of the client. And then during the test, the client will be on a C position or side-lying position to expose the back. And after the test, the client should lie flat for 1 to 2 hours. It used to be 6 to 8 hours. Now it's 1 to 2 hours. No pillows are allowed. And the supine positioning for the first 2 hours after the test is done in order to prevent spinal headache. So pay particular attention to the fact that during the procedure, the patient is positioned side-lying, and after the procedure, the client must be placed on supine position for 1 to 2 hours. No pillows are allowed. So, for example, if you have a male client and the wife says, "Can I bring 2 pillows for my husband's use?" If it's going to be for the head, then that's not allowed. But if it's just going to be for the side of the patient where they can place their hands on it, then that could be allowed. So no pillows underneath the head after the test. The client must remain flat for 1 to 2 hours. So that's one thing that you have to highlight in terms of your client's care. Post lumbar puncture. So join our hundreds and thousands of nurses who pass the NGN through the Ray A. Gapuz system. So these are proofs beyond reasonable doubt that our system works. And a lot of nurses find it as the best in the world. So those of you who would want to have a short course or a quick fix for passing NGN, join me on January 8 to 20. That's going to be at the Mount Crest Hotel, Gapuz, Baguio. And we're going to have our boot camp for 2024. That's going to be for the first quarter of 2024. So join me and experience a technology-enhanced learning environment like no other. Will make you pass the test just in 10 days. And if you need more, we'll provide you more with no additional fees. Okay? So the next NCLEX RN alert that we'll have for this session will be your alcohol withdrawal. Now, what are the things that you have to remember related to alcohol withdrawal? First and foremost, note that the onset of symptoms could be early, and it could be as early as 6 hours after the patient's last drink. Or it could also be late, and it could be as late as a week after the patient's last drink. So what are the symptoms that could occur early? So remember the code SINS, okay? SINS. So S, shaky hands, I, insomnia, N, nervousness, and S, sweating. So this group of symptoms could occur within the first 6 hours after the client's last drink. Now, on the 12 to the 48 hours, or as late as a week after the client's last drink, the client may experience your delirium tremens. That could come with delusions, as well as, remember, hits, hallucinations, which could come in visual hallucinations. They would fear shadows. That's why you have to provide them a well-lighted room that's quiet. And it could also come in the form of tactile hallucinations. So the patient would actually tell you bugs are crawling underneath the skin. No, your intervention as a nurse is to present reality and tell the client that you don't see bugs. However, you acknowledge that it's real for them. However, you don't see it. Then you have I, increased vital signs. So there could be elevated blood pressure, elevated pulse rate. Then T, tremors. Coarse tremors occurs in alcohol withdrawal syndrome. And then S, seizures and sweatings. Now, all of these symptoms could occur as early as 12 hours after the client's last drink or a week after the client's last drink. So your intervention is to calm the patient and provide them with quiet room, because alcohol is slowly metabolized in the body. So the only intervention that you can do is to tell the client or reassure the client that eventually the symptoms would go away. They just can initially slip it off. So they just have to have a good night's rest. Then eventually the signs and symptoms will decrease. And aside from providing a comfortable room, you also would need to increase fluids, like providing them sparkling water, kombucha, or low-fat milk, including a diet that's high in carbohydrates. So snacks that you could provide the patient could be in the form of pretzels or apple slices. So this would help the client cope with alcohol withdrawal. Okay? And the next important thing that you have to consider if you are preparing for the NGN is you have to learn how to study with technology. Now, there's one student who came to me and he told me about his experience that sometimes what he has in mind is correct, but the moment he moves the cursor in the computer, so he's not adept at doing the click at the right time and at the right part of the screen. So taking the NGN requires more than knowing your facts. It requires you to possess your skill in terms of navigating a technology-enhanced testing environment. So it's best that you learn with technology. Here at the Gapuz system, we're the only one in the world that has an NGN simulation room. Okay, so I asked one of our students, which one helped you the most? This is what she says. I set aside S that pertains to a book, and then I already used yours. Okay, so specifically, she's talking about the pharmacology, quick fix in pharmacology, and NCLEX 311. So NCLEX 311, the 24-hour guide for passing the NCLEX RN, is very useful. It's actually the Bible of NGN passers. And this is the local edition of my internationally published book, published by Jones and Bartlett USA. And that's your NCLEX RN in a flash. You can actually check it at Amazon, and it's pretty pricey in the US. But here, if you are in our system, you get a free copy of NCLEX 311 which is the local edition of NCLEX RN in a flash. So I asked another student, what book helped you the most? And he says, 311, sir, especially the key points in the book. So in NCLEX 311, you have a nice presentation of concepts, from the functional concepts to sample questions to the answers to the rational and the pointers that one of our learners is trying to is talking about. Okay, he's trying to highlight it. And of course, it's also the Bible of our international students. NCLEX RN in a flash in the US, NCLEX 311 in the Philippines. That's a part of our learning tools that are available only at the Ray Gapuz system. Remember, you have here Lippincott, Saunders, and of course, ABCs of Passing by Ray Gapuz. So it's always nice to be up there with the greats in NCLEX RN Review. And this is a picture of our simulation laboratory. Okay, so here's another student who says, Sir Ray, thank you for these books, truly concise, direct to the point, and very organized. So I also asked her, were the core shells helpful? And this is what she says. Yes, super. Actually, your core shells are more difficult than the actual test. Okay, so that's the kind of training we have there. Here is our screenshot of the contents of our core shells. It contains all the subject areas that are being tested in the actual test, like safety and infection control, basic care and comfort, health promotion and maintenance, management of care, pharmacological and parenteral therapies, physiological adaptation 1, 2, and 3, psychosocial integrity 1, and of course, your management or reduction of risk potential. Okay, so we covered practically all, and you have 8 different activities per core shell, and these core shells are being updated on a monthly basis. And the most important thing while preparing for NGN, you have to be in a very conducive environment, because a conducive environment should keep your sense of focus. And here at the Ray Gapuz system, we are the only one in the world with our NGN simulator that's produced by our own system. And of course, we keep the numbers comfortable in our class. So may I invite everyone to avail of the next generation NCLEX RN Flex, the most flexible test prep class for the NCLEX RN. The fee starts at 3,499 pesos, or that's less than $100. Okay, your choice of live face-to-face class, live virtual class, on-demand unlimited video recorded lessons, QBank and 3 books, NGN strategies and sample questions by Dr. Ray Gapuz, and of course, the quick fix sessions. And I'd like to share with you a picture of the interface or the homepage of our official website, the RayGapuzReviewSystem.com. So ace your exam with expert instruction and advanced technology. So here is an advice from our passer who is a PhD prepared nurse, Mr. Conrad Katimbang, who passed the NGN through our system. This is what he has to say. Believe in yourself, learn to trust, burn your midnight oil, sacrifice, make no excuses, find a job or find a way to join the boot camp or quick fix at all costs. Read 311 and Pharma Book 5 times, and fail not to watch the core shell. Indulge in Pecha Kucha, that's activity number 4 in the core shell. It's one of the favorites of nurses, and NGN samples. Give it your 200% and leave the rest to Almighty. All the best. Thank you so much. He said that in Filipino. Okay, salamat po so much. That's Conrad C. Katimbang, USRN. So join him and thousands of others and pass the NGN on your first try. We have a 3-day program, a 10-day program, a comprehensive functional concepts discussion that could be just on weekdays or weekends. It's very flexible, and it would just require 5 hours of your day. So once again, this has been your mentor, your fact check buddy Ray Gapuz, saying thank you and see you in my next video. Take care.